we now are going to start our panel one, which is topic which is about leveraging technology for citizen empowerment and last mile inclusion. And in this today's agenda of emerging technology, this is in fact a very interesting and very important topic, because ultimately through the use of technology we want to empower and make citizens' life easier across various departments of health, education, transportation. And the esteemed set of panelists and speakers who are going to join in this session are going to be from various departments: Department of Health, Department of IT, Procurement Agency, and speakers who are going to join have traveled from various parts of the country. So I would like to now take this opportunity to welcome the esteemed panelists of this session, leveraging technology for citizen empowerment and last mile inclusion. Starting with the very first name, I have Shri Narayan Swaroop Nigam, who is the Principal Secretary, Department of Health and Family Welfare, Government of West Bengal. Can we have you, sir, on the stage, and can we welcome him with a big round of applause, ladies and gentlemen? Next, we have our program chair and the brain behind today's program, Shri Randhir Kumar, the Secretary of Department of Information Technology. Sir, can we have you on the stage? Next, we have Shri Rajiv Rattan, the Managing Director of HARTRON, the Procurement Agency of Government of Haryana, and he's also holding the position of Special Secretary, Higher Education, Government of Haryana. Can we welcome you on the stage, sir? And can we have a round of applause going on for all our esteemed panelists? Next, we have Srimati Ma'am Prashasti Pareek, who has traveled all the way from Gujarat, and she is holding the position of Regional Commissioner of Municipalities, and she is also the CEO of Dahod Smart City. So I think she can add a lot of value in both the aspects from smart cities and urban development. Next on the stage, I would like to welcome Shri Dileesh Sasi, who is the Director of Electronic Delivery Citizen Services, EDCS, E-Governance, Bengaluru. And as I said, speakers have traveled from various parts of the country for this very important session. Next, I would like to welcome Ma'am Parul Gaur Mittal. She's the Special Secretary from Department of IT, and she's also holding the position of Department of Transport from Government of Arunachal Pradesh. Welcome, Madam, on the stage. Next, I would like to welcome Madan Mohan Chakraborty, who is the CEO of Iskraemeco, our partner. Thank you, sir. If you can please.
Iskraemeco.
Iskraemeco. Okay, great. And this session will be moderated by our Additional Commissioner of Police and Chief Information Security Officer from West Bengal, Shri H.K. Kumar. Sir, can you have you on the stage, please? I'm already on the stage. Okay, sir. Thank you so much, sir. So can we have a round of applause for all the panelists? And for this panel, we have precisely 1 hour. And over to our moderator for the session, sir. We have exactly 1 hour for this session. Thank you so much.
Good morning, everybody. It's my privilege to have such a esteemed co-panelist with me. Let me introduce all the co-panelists on the stage. Mr. Narayan Swaroop Nigam, he's my batchmate from IS West Bengal. He was Health Secretary here during pandemic, and we have seen the kind of work he and his department put in controlling the pandemic in the state. We have Randhir Kumar, the IT Secretary, and also MD Webel. They are leading the IT initiatives of the state government. Prashasti Pareek, Rajiv Rattan, we have on my right. He is 2008 IAS from Haryana cadre. He is MD of HARTRON. HARTRON is I've just Googled yesterday. It's supposed to be a skill development initiative of state of Haryana.
More into procurement of electronics.
Okay. So he will talk about more when he speaks. We have Prashasti Pareek from our own Silicon Valley hub of the country with us. Prashasti Pareek is from Dahod, right? And Dileesh Sasi, difficult to pronounce, from Bangalore. And Parul from Arunachal Pradesh. And of course, Madan Mohan Chakraborty, CEO and MD, Iskraemeco. I have pronounced correctly, right? Okay. So this is how I'll start. I'll ask each panelist to first speak for initiating comments and share their experiences, and then we'll ask leading questions, and we can take few questions from the audience if the time permits. So I would like to start with Narayan. We can start with you. So first of all, I'll request Narayan Swaroop Nigam to talk about his experiences in handling pandemic using IT initiatives in the state of West Bengal.
Good afternoon, everyone. Thanks, Kusmakar, for all the kind words. You have given me a difficult task, and putting up pandemic and information technology or a technology together. But definitely, let me tell you one of the things. You know, we are all, you know, like me, Kusmakar, Randhir, we are a trained engineers, so we usually think digitally. We are very comfortable with the data. We'd like to analyze, but our analysis stops at the level of Excel or Access, and we try to think through the things. You know, I had a different experiences in dealing with technology and putting it across for the citizens' use. Prior to becoming a health secretary, on one fine day during the first wave, start of the first wave, then handling through the entire 3 waves, 4 waves, whatever your people call, of the COVID, we realized that the technology is a medium to make the system smart. And if you look at the different times in the human society, around 150, 200 years back, we had a printing technology came into. And the printing technology led to the publication of the books. Publication of books led to the proliferation of the ideas. Newspaper printing is started, which led to the further dissemination of the current information and led to the revolutions in entire Europe. So same way, if you come back and look it back, in the 50s or 60s, we got a transistor. We used to have a diodes and triodes, and then came the transistor, which led to the electronic revolution, which led to lot of automations. And sometimes in 80s or some other time, when the US government invested very heavily in the defense technology, led to the development of the internet. When we graduated in 94, 95, there came something called World Wide Web came. And that led to the development, and with the development of the computing speeds in around, say, in the last 15, 20 years, lot of computing speed has developed, and it led to the information technology and information revolution. And the big data, big artificial intelligence, all those technologies started coming in. But more or less, at least in our country, things have remained with the intelligentsia and the newspapers, and somehow things were not being transported at the speed in which the technology was moving, and the speed at which the citizen service move is a very different speeds. Like our first experience with information technology being used for citizen service was a railway reservation system. Earlier it used to be, if you want to book a train, return train from Chennai to your Delhi, a telegram will go, something else will happen, and then it used to come, and then it emerged in 80s and 90s. Understanding this, that this is what has been a speed of implementation of information technology in the different government system, because once you put it in a government system, it's a system which is too big. And in India, anything when you put it to public domain, it is very difficult to correct it mid-course. That is why just wanted to give a feel, why many of you, since you represent a private sector, why you feel that the decision making or implementation of technology in government is slow. It's not that we are slow, but we have to be cautious because we deal with the public systems. How much information, see, any point of time, any data processing is possible, but how much information has to be given to public becomes very important. It has to be protected because of the privacy laws. We do not have that kind of privacy law as there in the many different countries. If you look at it, I was visiting UK when I was in power sector. Today everyone talks about smart meters. Now, what do you feel? How much every house, if I have information that how much power is consumed there in every minute, what a catastrophe information it may cause if this information is available on a public domain. Do we have a laws to protect that? about who will be the authority, who will keep the data, and who will be authority, who will judge that this particular authority wants the data. Today, if you are sitting here, if I look back at home and I suppose someone is whether the air conditioner is on, to prove it whether you were there or where were you, and who can use this information, think about it. So whenever we talk about any use of the emerging technology in the government sector, there is always bound to be a time lag between the two. But definitely the speed at which it is developing, it is definitely going to cause a revolution in the government. Now coming to the basic question, how we are using the information technology, I will talk about the examples that we are using it in our system as of now, what we intend to do in near future, what we have done, achieved in the past. Now look at it, the entire COVID pandemic scenario in which no one knows what is to be done. Doctors are not available across a person. A person who goes inside a hospital, his family is not aware what is happening. And there are 10,000 people admitted on different wards. 20,000 people are bothered about the information. How to take care of it? This becomes a basic issue. It was used now in this system, we use the information technology for a very effective communication. What we did? We just put across a system, LAN system in every hospital wherever the COVID was there, COVID wards were there. Sister was in one data entry operator was trained. There are 10 to 15 parameters which have to be monitored. 10 maybe on a daily basis, 4 on an hourly basis. Now this kind of information was just digitized. We put it across a system to understand two things. For a clinical perspective, how many serious patients are there? You need any help for their treatment? Because it's very difficult even to move an expert doctor in every hospital. There may be trained medics who can be there on the floor, and there can be trained senior persons who can look at the data and suggest you this is what is happening. So this is what we are doing it very effectively. We called it COVID patient management system. Many of you must have experienced it. I would like to share that every information we used to look at it, say in a CCUs, whether there are unwanted fellows, they are there in CCUs or not. The resources are, whenever resources are in crisis, you have to go for a correct judgment that this person needs to use this resource, this person doesn't need to use it. So we use this entire information. It was there on with us, not shared with everyone. So we used it, asked the person, why are you having this many persons in your ICUs when they are not using the ventilator, when their oxygen requirement has gone down to this, we shift them to the ward. So we used it for effective management of our assets. Second is the family gets curious. The media is on us. That what is Amar Baba ke ki hoche jani na. Now what we did, that we created a SMS based system in which we used to register the mobile when the patient is admitted. Every 4 hourly data, that what is his current condition, whether it's serious, normal, how much is oxygen going on, was to share. You just put a SMS in the system and the reply used to come that this is your current condition of your. So this solved a lot of our communication issues. Third issue came regarding how to use it. Now people want to see them. People inside a ward, you need to have a good mobile systems cannot be created everywhere. LANs cannot. So we went ahead with the tabs. We put it across there, given it to our nurses. They used to put it. And the people used to communicate with their family members with the help of tabs. So this is a limited use of the information technology we did. But something more relevant that we are doing today is to improve the access of the healthcare. If you have a, suppose you are coughing, you want to show it to some doctor. Most of the time, all of us, since we know someone, we have a house physician or someone with whom we develop a rapport, we talk to him over phone. But what happens to a person who stays in a remote area, whose sons and daughter-in-laws are all out the whole day for their job, to meet their day-to-day, reaching out to the remote place which is a block. If some of you are aware, our health system is arranged in a tier public health system. Going to the nearest place where the doctor is available, maybe around 10 to 12 kilometers, it will cost you 1 day wage. So that may be around 300 rupees loss. Of the person who is accompanying you, in case someone is accompanying you, another 300 rupees for that family, plus 50 to 100 rupees one way of traveling expenditure. So it is a 1,000 rupees business if I have to show it to some reasonable doctor and I have to wait for a whole day, whether all tests will be performed or not, it is also not there. Can the information technology be used for this purpose? And we have used it. We have recently launched our information telemedicine portal. We call it Swasthya Ingit. Our Honorable CM has given it name of Swasthya Ingit. We have 50,000 consultations going on every day. Ladies who are never seen a face of a doctor are able to get their bloods examined. Trained doctor is on the other side communicating and the medicines are being regularly disbursed. It's a silent thing, but whenever we go to the field, we verify. A lot of access to the healthcare have improved because of this initiative. Now, a person who is sitting there, you cannot have a doctors everywhere. I have around 17,000 such clinics in Bengal everywhere. I cannot post a doctor there. Even if a MBBS doctor is posted there, he will not stay there. If any one of you is also posted there, you will also not stay there. So how to ensure access to the health is a bridge which the information technology provides. This is one part of it. Second is that you generate a huge, second is suppose you want to extend a specialized treatment. Say a person who gets a brain stroke. All of a sudden anyone can have your brain artery gets clogged with the cholesterol and the supply to the certain part of brain comes down. You need to be given a thrombolysis treatment in another 4 hours. That's a golden period. A person sitting in the remote Matha Bhanga area of Kuch Bihar district whose closest neuromedicine facility is available in Siliguri. Is he destined to get this? That if you get a person if in Matha Bhanga, either the God should make a geographical imprints and ensure that in this area I can, no matter what, for next 50 years there should not be any brain stroke or the person should be permanently paralyzed. So we again went back to that. And we asked our doctors, can we do something about it? They said, good enough, sir. You give me the CT scan data. We will suggest a line of treatment which can be given extended. It's only the administration of the drug which will be possible with the help of local MBBS doctor or someone. So we ensured that. Initially we were very apprehensive. But we went to the people who supply us the CT scan machine like Siemens, Philips and all, Wipro and all. They said, fine sir, we will create a cloud facility. Then your emerging technology came in very handy that the cloud facilities are something which can be put to use. So it was uploaded there. Access was granted here. Immediately the person concerned downloaded it, saw it here and the reply went back. And we could, believe me, we could save around 2,000 lives till date, silently. Same way now we are going to extend it even for the heart attacks. In the remotest area, you may not have an expert advice available. In the remote area, you may not have a nephrologist available. So why I am saying that, without going to the too much of the nitty-gritties, even the thinking digitally and thinking that this is one of the usable traits which can be usable technology, which can be used to do something which looks simple, which doesn't happen. And our 90% things in a public systems are simple and they are gradual. So this is what we are doing it in a quantum way. We do not want to change the system in one day. Rather, it should be a quantum-based approach that, fine, I will do this. Then once the system stabilizes, I will do this. Because again, the people are not ready to accept the change so fast. Even the concerned changes in the healthcare, the regulatory changes are not there. Even if I was asking my VC of Health University, do you teach even once in any of your professionals one course on data science? She said, no, sir, initially we do teach little bit of Excel, little bit of this, that, and that's an end of it. Rest everyone thinks, everyone is, picks up this entire trait on its own. So this is one of the ways in which we can use, and then the data is phenomenal generation. I was thankful that Mr. Das was talking about anonymizer. We get all the fellows rushing to us, sir, we want your data, right from the drug trials to the number of people who are having you see the huge data you have an age profile on which when you can declare that this kind of eating habit in this kind of environment will cause your heart disease. We have huge data. If we can work it out together, it's possible. Again, with the anonymizer and all those things place, it can be created. Other day we were discussing like there is a 26 lakh people in Bengal today need their cataract operations. Suppose I have to liquidate it. How the usual cataract operation takes place? I get a person to a nearest empty optometrician which is away from his home place. After post 60, I don't know how much of you have an experience to be in a rural area, person is immobile. He is brought to a place where his eyes are tested, then the analysis done, and then whether he's a cataract or not, then a date is given. But if the systems are such that I take an eye photograph, medical science accepts that the system which is generated is acceptable and we should get that person immediately for an operation. Now here the problem comes. You can develop a technology, but accepting it for a public consumption becomes an issue. So there has to be some very clear-cut, demonstrable issues which has to be technologies. There should be a board which should sanction such innovations in every domain. Say whether it's an agriculture, whether it's a water testing, whether it's electricity, you need to look at it because emerging technologies transfer to the public usage is a huge gap which exists, which needs to be regulated, which needs to be accepted by a clear-cut demonstrable thing, and then only we can take it forward. I end with my another experiment that we did when the Kusmakar was then also in the looking after additional CP public transport in Calcutta. I used to be a managing director of West Bengal Transport Corporation. Your buses, Calcutta, contrary to the belief, Calcutta is one of the most resilient public transport system. Around 95% people in Calcutta use public transport for their movement. Now the question came, which bus comes when? Now, if I go to any one of the big developer, he asks for a huge money. There's a lot of, the regulation, whether the bus driver will put it on or not, whether it will be on, whether it will be off, whether the protocols are there or not. So ultimately, looking at everything, what we did, we created our own app. We called it Patodisha app. I don't know whether it's operational, but at that point of time, we have a 3 to 4 lakh people using it every day. We used to transport. What we did, we created a system in which every bus was sending the data. We went to the drawing board with the people who were designing the protocol, which bus location भेजना होगा कि रूट लोकेशन भेजना होगा कि टाइम स्टैम्प भेजना होगा कि स्टार्ट के समय जाएगा कि एंड के समय जाएगा, all those issues. Sir, I tell you, the theorists, when they develop a standard, if it is not implemented and tested in a public system, it never works. So we changed the entire protocol and it started working. Then we said, then a lot of developers started coming to us. That, sir, we also want this data. How to share a data? Then became a big question. So we went up to it took us 1 year to make the government agree that we will have a data policy for this. We have an open data policy. So we said, fine, now we started creating a data. Then we went and met the Google. Can I use Google Maps to feed in my data? So I had a chance to go to Singapore. I met their team there. So we learned about GTFS technology, that the transport feeds can be given. So we started doing that also. But it took us first time understanding, working hands-on to realize how complicated these things can be. One side I have a driver and a conductor who needs to be sensitized. For him it doesn't matter. He says, bus aa rahi hai. People are used to it. People are not accepting that. People, good if it comes, but if it doesn't come, it doesn't matter to me. I'm ready to half an hour, I will chill around, have a cup of tea and wait for my bus. So this is how, you can have a technology. Technology speed is very much possible, the kind of computing speed that you are going to have it. But if you want to put it to public use, you have to understand the requirement of the public systems, accept that the people who are going to use it may not find it that much important to begin with. But once it is posed in a good way with little bit of regulation and little bit of facilitation in their process with some demonstration, it becomes acceptable. Look at Phone Pay and RuPay and all those things. Today, whenever the Blinkit comes, we don't take out the money, give the change, keep the change. We say, show me your scan QR code and I will pay. Forget about it. So this is what is the entire emerging technologies, and all those things are very essential for advancement of human society and building up a systems and getting the smartness in the system. Except that speed of acceptance in a public system is going to take little time, but we are open, and we are open to the idea, and we are also as interested and as intelligent, or not more than as intelligent as any one of you, for that change. Thank you and all the best. I have, there are a lot of issues of health issues are going on. If you have one or two questions, I can take Kusmakar and then I can push off. I take one or two questions and then I request the moderator.
Since he is running short of time, if you have any question, otherwise we'll leave him.
Good morning, sir.
Yeah.
Myself, Arun Pandey. I am a IT person and running a company in Kolkata. I wanted to know what our West Bengal government is doing to upgrade the ambulance system.
As of now, we have a 102 ambulances, which is basically take care of the mother and child care. It's a call center based system, which we have shown its demonstration during the COVID. We used to call up, I don't know how many of you have used it, but every day 1,000 ambulance we have put in. You dial a number, you get it transported easily. Same way we do it for mother and child care. Same system we are going for our own next round, that 108, all emergency ambulances are going to be organized in a call-based, center-based system.
So I have a query.
Yeah, please.
In case of emergency, suppose if I am a patient and I don't know the local places of Kolkata, and if I met with an accident, so should I call to 102? Then the call center person will ask me where I have made the accident because I don't know the place.
No. We are also trying to emerge to a solution that wherever you are, you just click it on an app. You will show that the nearest hospitals which will be available for your treatment. That system is almost getting ready and tested. We will launch it very soon, so you can come to know about it.
Means if we do not have network on our app, so is it possible?
So that is what I have not thought of. Network. See, you have two ways of it, communication. Either you use a network and go to the app, or you can call up a landline number, and from where you can get a guidance that where else you can go.
Okay, sir. Thank you, sir.
Sir, with respect, I would like to say this. You have been speaking about privacy and the challenges of providing data, etc. If you see the latest privacy law that the central government has brought in, you would see that they have clearly stated that yes, there are certain things that people need to do, but for startups, there is no law. Startups can do anything. What I am trying to say is the central government's policy seems to be that the challenges of this country is so vast that until and unless things are brought out, things are tried out by innovative ideas, things will not happen. And for that you need data. And if this data, now West Bengal is a state in this country, if we do not provide this data because of our beliefs here, it's possible that...
You're absolutely wrong, sir. It's not that we don't share data. It's not that we don't share that. We do share a huge data as per the state data policy. There is nothing correct. In fact, there are many apps in the bus sector which are running on the data shared by the West Bengal Transport Corporation itself. So that's not true that we don't wish to share the data, but definitely we do take care of the privacy law, which is now a fundamental right after the Supreme Court's judgment. So maybe we can discuss a little bit off the cuff that offline that this is required. Yes, please.
I think we are running short of time, so we are not taking any more questions on this subject. We have more panelists to speak.
Thank you.
Thank you, Mr. Nigam. May I request Mrs. Pooja to come forward and hand over mentor to the So let's take it forward to the next panelist. I would like to ask Rajiv to share his experiences about his experiences as MD HARTRON and specifically Higher Education Government of Haryana, how he is using technology to leverage the EdTech sector. I'll request him to be brief because we are running short of time. We have another 25-30 minutes, so we'll have to wrap it up. So just request to be brief.
Good afternoon, everyone. As sir has told me to explain what we are doing in Haryana with regard to IT, I'll be putting in another perspective. I'll be putting this the perspective of a common man, how he is linked with the government and what are the timelines he require intervention from the government side. If we see as a common man, there are mostly 4 times he has interaction with the government. First is with his land and land holding. Second is with his occupation. Thirdly, with regard to socio-economic indicators or socio-economic facilities he requires. And fourthly, the education sector. In Haryana, if we go into the land holding and land thing, there is a lot of intervention which has taken place in the last 10 years. A farmer in Haryana can go to a CSC and inquire about the status of his land. He can even get the registration done through online mode. He can take an appointment from the Tahsildar and can do the transaction of the land at the sub-Tahsil office on a particular date and time. With regard to the occupation, we are having e-Khareed portal. We are having Mera Fasal Mera Byora portal, in which the farmer himself can get registered. He can register his land, the amount of land holding, then the acreage of land, followed by what he is sowing, so that the government, when it buys the produce from the farmer, knows exactly what is to be paid to them. And then when it comes to the mandis, where the produce is being sold, gate passes are issued electronically, so there is no intervention of the Artiya, which used to be the bottleneck with regard to government and farmers for the payment. Every payment is being made electronically through e-Khareed portal, and the middleman is now taken care to a large extent. With regard to socio-economic issues, the old age pension, the widow pension, and then the SC certificates, BC certificates, income certificates, that is also being done electronically in Haryana. The fourth part is the education setup. In education setup, there is a portal of Haryana Har Chhatrvriti, where the student himself enrolls him in the college, from where the post-matric scholarships are being disbursed to them electronically. There is no paper involved in this process. The process is paperless and everything is being done electronically. The reimbursement forms come directly in an electronic form to the state headquarters and then put forward to center for reimbursement through PFMS. These are the 4 main issues which have been taken care in government of Haryana for the last 10 to 15 years. There are improvements in the system, but the biggest improvement which has come in the last few years is the PPP. I think everybody has heard about PPP. It's not, no, it is not like that. It is Parivar Pehchan Patra. We have an authority in Haryana, the Parivar Pehchan Patra Authority. It's a 8-digit characterized unique ID given to a family and its members. It's a very unique database which has been created under the Citizen Resource Information Department, wherein the data is collected from the people then from the agencies, the government agencies, and then validated at 3 points so that the secrecy of the data is maintained and the authenticity is also maintained. It also, I would like to tell a bit more about it. Electronic verification is done through 2-3 means. First, the government officials way. Another one, the certified data. We already have data through the government databases. And then if there exists any issue regarding the authenticity of the data, we have teams made at district and block levels which authenticate the data by visiting the people. So what exactly it is different from the other databases? It has the name, address, gender, caste, income, occupation, and even the assets of the person. So what has this database done to enhance the quality of the life of the citizens? To begin with, out of the 3 crore population of Haryana, 2.8 crore has already been enrolled in PPP. Almost 4 lakh SC certificates have been issued. 2.5 lakh income certificates have been issued. 25,000 beneficiaries of old age has been added. And the best part is 9.6 lakhs ineligible families have been excluded from the PDS. When we exclude the ineligible, then we open the doors to include the eligible. So this is one of the best initiatives which has taken place in the state of Haryana. 15,000 plus school, colleges, universities, the admissions have been integrated through PPP. So it is a real-time based database. And another initiative with the use of PPP, what the government of Haryana is going to do is, we have defined 4 major time frames in a person's age. 0 to 6, the women and child department will take care. 6 to 18, the school education. 18 to 24, the higher education department. And from 24 to 65, the youth empowerment and social welfare department. Every person in that age group is being marked now. The departments have been given the responsibility to mark the person and see what they are doing right now. For example, I am taking care of higher education department. So the age bracket of 18 to 24 years of age, we have used your NSS volunteers to go door to door and find out if there is any person who is not going to the college. If he is not going to the college, what he is doing, from where he is getting his income. So a complete database is going to be created so that we can see where there is a skill gap, and we will try to fill that skill gap. So such kind of interventions I don't think were even possible when we joined the service somewhere around 2008. But now in the last 5-10 years, the technology has taken a big leap, and such initiatives are now possible. And I would like to thank Elets that they have given me an opportunity to showcase what my state is doing in this regard. Thank you.
Thank you, Rajiv, for giving a brief outline of the IT initiatives in Haryana. After that, I would like to move to Prashasti. I would like to ask Prashasti to talk you about the smart city concept. Smart city is a loosely talked terminology everywhere, but I think not most of us understand very clearly what exactly it means and what exactly you are doing in your city of Dahod to justify this tag of smart city.
Good afternoon to the esteemed gathering. Thank you, Elets, for giving me this opportunity to present what my state and smart city mission is doing, especially in my city. So, as Sir is saying, what is the smart city mission about? It is, in the simplest sense, if I can attempt to lucidly explain, it is to make the cities livable, accessible, to improve the quality of life of the people living in. And in that sense, making a dignified life, as the Honorable Supreme Court has also focused, to make a dignified living and making a well-being for the people of the city. So Dahod is a peculiar case in this on the map of 100 smart cities, and that is why I'm here to represent it. So it is the only municipality amongst the smart cities. Rest of all are municipal corporations, or at least capital city of a UT or a state, even if not a municipal corporation. So just to give you an introduction that it is a tribal city, it's a tribal district. To just give you an idea that on the other spectrum, Dahod is an aspirational district identified by the Niti Aayog. And on the other hand, we are in an attempt to make it a smart city. The district headquarters of the Dahod city, Dahod, we are making it a smart city. We are striving to do that. So it is on a fast digital transformation journey, and digital transformation has expedited the overall smart city mission in Dahod. So there are a lot of projects that we are taking up in Dahod, both infrastructure projects and software projects. But as the mood of the conference today is emerging technologies, how technology has facilitated inclusiveness, last mile inclusion, and facilitated the overall well-being of the citizens. So it is my duty to explain. So integrated command and control center, that is at the heart of the technological revolution of the smart city Dahod. So just imagine, as I told you, the geographical and demography, it's a tribal district, 100% tribal district. And it is on the confluence of Rajasthan, MP and Gujarat. Again, it's a border district which has its own challenges. And a small city like that, if I talk about the geographical periphery of the city, it's just 6.5 square kilometers. Just imagine. And we are coming up with a 128 crores ICCC integrated command and control, such smart and state-of-the-art infrastructure in that city. So we have, meaning expedited it by say 50 years or so. Its transformation, its smartness, its development trajectory. So just to explain what integrated command and control center, the gathering I feel you all already know, but how Dahod, it has helped in Dahod is that we have, for any urban local body, for urbanization, what are the basic things that a citizen requires? Quality and quantity of potable water. Then there should be drainage system should be there, and above that, even the first thing that I forgot is the cleanliness. The minimum that a citizen looks for in her city is cleanliness. And so all of these aspects are monitored by, they are taken up by various agencies, again in smart city, as well as by various projects of Government of Gujarat and Government of India. But how smart city ICCC is monitoring them. So we have a state-of-the-art, this building, ICCC, which is where we can monitor, say, door-to-door collection. We have the dustbins have been equipped with RFID tag. So when this door-to-door vendor, he comes for collection, then it is clear to us on a real-time basis which are the unserved areas. If I talk about water, we have a separate SCADA system for this, but again integrated with ICCC to have a real-time statistics on the quality and quantity of the water that is going in every nook and corner. So when I say it's a 6.5 square kilometers city, but it has a population of 1 lakh. So it's a densely populated city. And so again, and if I talk about large areas where ICCC has been used, technology has made interventions, so we have huge programs that have been conducted by Honorable PM coming to the city. So lot of buses, they came to ply the people. So it was again monitored on a smartly basis on this. During elections, 900 cameras, which were again installed under ICCC. They made that free and fair election was conducted. They had a role in conduction of free and fair election. Then health sector is, if we are talking about technology, as Sir started, we cannot go ahead with any transformation if we are not making initiatives in health sector. So telemedicine has been taken up, and it has been again integrated with integrated command and control center. We have a hub and spoke model in this. So we have a multi-specialty hospital which has come up with Government of Gujarat and Zydus. The civil hospital has been transformed on this model, and we have a hub there, and spoke is there in this across the tribal district, so going beyond the urban area. So smart city, it is now going beyond the city limits, and it was especially useful during the pandemic times. Again, traffic has been, there has been lot of improvement in the traffic behavioral sense, because we have red light violation detectors under this, automatic number plate readers, a lot of cameras. Gujarat government is already running a Vishwas project by Home Department, where already CCTV cameras are there in the smallest of the cities. This has been also been integrated with ICCC, and contextually this makes sense when it's a border district and theft is traditionally and contextually easier to be there in this border city, so anybody can steal and they can just cross the border. So we have a lot of crimes, like in the recent times, about 120 crimes have been detected directly by the intervention of integrated command and control center, using the different cameras that we have in the Dahod city. And we all know in law and order, conviction definitely has an effect, that somebody is seeing us, we are getting convicted, then it has its deterrent effect on the law and order situation. I just want to be a little deviant in this technology summit. That technology cannot be a panacea. Ultimately, there has to be marriage of technology and people's acceptance if we are in the public sector. As Sir was also saying, that if it has technology, has to make inroads in public sector, people have to be taken along. So that is why if I talk about our integrated command and control center, we are having regular visits by people. So it should not be neither a white elephant, neither it should be something that they can just hear in media. So we are having continuous visits, internships of students, and visits from all groups of public, from all lives. They should see, they should come and see that what kind of infrastructure is available in their humble city, and they can know that that is what was the theme of today's discussion, that how the citizen can feel empowered. That I can have information asymmetry is the biggest loss, and that disempowers a citizen. So this gives them confidence that we can also have access to information, our city is having this infrastructure, and even they can give some suggestions. They can on real-time basis see that if the simplest thing, door-to-door collection, that okay, if I am making a complaint that garbage was not collected from my area today, then it is being monitored here also. And if not on proactive basis, reactive basis only, some action is being taken against the defaulter. So I would just summarize that if technology can make inroads and make transformation and make improvements in a small and humble city like Dahod, it can do wonders when taken up at a large level. And there are umpteen examples that have been put forth by my co-speakers and will again by my coming speakers. So that is what we have done, and limited, if I can limit myself to our initiatives in Dahod, and that is all what we are doing. And there are many other initiatives that we are taking, but for the sake of brevity and time, I'll summarize it here only. Thank you so much.
Thank you, Prashasti. Good to know that Dahod is the only municipality under this smart city project. We wish you all the best for this endeavor. I would like to ask the next question to Dileesh from Bengaluru or Karnataka government. I just came to know that Karnataka also have its own form of CSC like West Bengal. We have our own Bangla Sahayata Kendra. And all of you must be aware about this CSC experiment to reach out to provide citizen-centric services to common people at the ground who are not very IT savvy, they don't have much access to network or technology. And they go to a place where they get access to many government services, citizen-centric services. So I'd like to ask him his experiences about his own kind of version of CSC, and also about the IT initiatives taken by Karnataka government, because we all look up to Karnataka as a technology leader in terms of everything, because Silicon Hub, our own Silicon Hub is in Bangalore.
Thank you, sir. Good afternoon to all.
Thanks to Elets and State of West Bengal for providing this wonderful opportunity. So I'm representing State of Karnataka, and my department is EDCS, it's the Electronic Delivery of Citizen Services. So I am the last mile delivery person for the government. I'm delivering the services from various departments, almost all the departments, to the citizens. So we have more than 80 departments and 860 services onboarded in our single service platform, which is called Seva Sindhu, from where citizen can access their own services. So we started with that, with the single service delivery platform. It's a tech-enabled system so that the service thing will reach the last mile citizen. He can avail by himself. And along with that, wherever citizen can't avail the services by himself, we started providing assisted mode of service delivery also. Already common service centers were there, but we had identified some issues in the system, like their distribution was not uniform. And in some places it was difficult to control and put them in work also. We started with a parallel system where we have these service centers called Bengaluru 1 centers in city of Bengaluru, Karnataka 1 centers in all major cities, and Grama 1 centers in almost all the villages. So total number of all these service centers are touching around 10,000, and we are providing almost all the services other than the state government services through this system. So like we are the department which provides technological support both to the department and to the citizens so that they can avail the services. So we are advising the departments how their service delivery system can be more robust. Their process can be re-engineered. Most of the data and other things they need can be provided from the existing databases and the system. We can make it more foolproof and secure with available technological solutions, and it can be provided to the citizens. For the citizens also, we will make them aware that you are entitled for these kind of services. You just feed in some of your data, and the system can predict that you are eligible for what all services, you are eligible for which all welfare schemes and pensions from a government. And sometimes we will tell the departments also that this will be your targeted population, especially during COVID. Our state CM announced some support system for different section of society, like drivers, taxi drivers, and street vendors. So our system was able to immediately identify those people from the existing database, and we were able to directly transfer the support money to their bank accounts without even they are applying or they were aware about the scheme. So these kind of awareness, we are providing the tech support, then we are providing this kind of awareness both to the citizen and the government departments. And on third base, we are providing the knowledge support also. Like I said, the citizen may not be aware about what all the things his credentials are. So just feeding in his one particular ID number, it can be his Aadhaar number or ration card ID. We have this Kudumba database, which has the database data of almost all the families in Karnataka. You just key in any of your data, and almost all your credentials, including certificates, will be auto-populated to the system, which will be visible to the government officials, and your job is done. Same knowledge can be shared with the departments also. So in this way, we will provide that knowledge support also. And to the last mile, after delivering the services, we are maintaining that feedback loop also. The citizen can communicate back to the departments that what all the issues are there, which is, like ma'am said, is very crucial for the service to be viable and more robust. And citizen and our operators are also contributing such ideas because they are working as a bridge between the citizen and the service departments. So they will also give that feedback so that we can keep on working our system to make the service delivery more robust and the system more safe and secure and efficient. So in this way, we are providing this kind of support. And like the point sir was asking for about our service centers. So like I said, we started these centers, and now they are going to an extra mile other than simply delivering some sort of services, like other than giving one caste certificate or income certificate. Now they are integral part of delivering welfare schemes also. They are the main people who are enrolling the citizen for the currently ongoing Ayushman Bharat card scheme. In less than 1 month of time, we were able to enroll more than 1 crore people. And in a single day, we touched around more than 3.5 lakh. That was the highest number in the last year in the entire country. So we are going to a next level also, that the welfare schemes can also be distributed to through these kind of centers. They are offering all these G2C services, both from state and central government, and they are offering some kind of P2C services also. So in this way, I would like to conclude because of the paucity of time, because the system should be like working with the support of technology
like as an identifier, enabler, and facilitator of the service delivery and citizen support. Thank you.
Thank you, Dileesh. Before I go to IT Secretary Randhir, I would like to ask Mr. Chakraborty. He is the only panelist among us who is from private sector, not from government. So I would like to ask him about his experiences about public-private partnership, because ultimately most of the technology or advancement in technology is mostly being done in private sector. It is coming to us a little later. So please share your experiences in this on the subject, how to collaborate with the government to leverage the technology in government.
Well, I'll be short and specific. So I'm from the industry of smart metering, and I'll answer you basically from that segment. Most of the utilities in India are from government sector. So smart metering deployment probably is the largest, not probably, in fact, the largest exhibition of public-private partnership. Now, how is it helping the government? And what are the vulnerabilities? How it helps the utilities? You get to know how much you'll be buying tomorrow. You don't buy excess, you don't buy short, number one. Number two, you can manage all your assets, because your assets are basically designed considering the power or the peak load management. So now you know how much traffic is there in terms of electricity, and you're managing exactly like that. The third thing is, security of the nation. With the smart city, or rather the smart metering technology, where the hardware is integrated to the software systems and to the meter data management and to the billing system. So this entire thing will tell you where somewhere there is excess power usage or not. And that kind of intelligence, you'll understand, I cannot be more elaborate than that, but how that will help the government to understand what kind of activities are going on in some specific areas. From the consumer point of view, how it helps, they know exactly how much power they are consuming at what point of time, so they can control. And for the marginal segment of the society, if there are some, if the limit is 150 kilowatt hour or something like that, they know on the 20th or 25th day how much power they have consumed. And they can monitor also their consumption. So this is going to help the consumer as well as to the utilities, the government, and the power generating organizations also. How it is working, the government has already decided to deploy nearly 250 million meters in India, and it is going in a full swing. West Bengal is not far. In fact, one of the largest deployment is already happening in West Bengal, started at 246 for the high value consumer. Now you'll understand this 1% of the meters are giving WBACDCL 42% revenue. Good and bad, okay, in two ways. But if this can be monitored, there will be huge efficiency immediately. At the same time, if it can spread, if that 42% can come down to 30% and 34%, using this, the economic advancement will basically progress from one area to another areas. So I think this is one of the biggest example in the world of private-public partnership for anywhere in the world, and especially in India, where most of the utilities are owned by government.
Thank you, Mr. Chakraborty. The last speaker of the day is Mr. Randhir Kumar. Randhir, I would like to ask you, the first speaker, Health Secretary, spoke about the time delay in adoption of technology by the government agencies. So, time delay in adoption of technology by the government agencies, what he was talking about. So, as IT Secretary, what can be done to minimize this delay? Because you are the leading all IT initiative under the state government or at the policy level.
Thank you, sir. In government, in government, there was a time when Telecom Minister of India said in reply to a question that telephone is a luxury. We have got 8 lakh telephone connections, application pending, and whoever is not getting, is not getting. That is 1988. This was there in Parliament. Today, it's like you have an app, you click, the SIM is delivered at your home. So things are changing faster. Another example I'll give you. There is a book written by Harish Mehta, the founder of NASCOM. The book's title is Maverick. In that book, he says that for getting 9.4 kbps data link from India to US was like, in 1978, was like, it's a Herculean task. Then they approached Visa. The company was VSNL, I think, Videsh Sanchar Nigam Limited. That was later, it was just founded in 88, 89, 80s. That company, they asked, we need 16 kbps data. Then they said, you will have to buy at least 6, and I'll be able to provide you in 18 months. So they provided in 18 months. Then it moved. The second sea link from Singapore to Europe was being laid in 80s. And first sea link was laid in 70s, the underground sea cable. And India was not part of first one. The second one, the industrialists, this especially led by F.C. Kohli, the legendary CEO of, the first CEO of TCS, they went to, up till the Prime Minister's office, they said, we don't have money. It was $20 million at that time. So finally they pushed it. After 1 year, government agreed and said, please talk to them if they can take the money in installment. So that was how we got onboarded on second sea link. And then after that, you see, from that place to till date, today India, last year only, in April, which went by, the software exports figure from India is more than $200 billion, which is more than the oil export of Saudi Arabia. So you can understand a tectonic shift has taken place. Now in this tectonic shift, the expectation of citizen has grown multifold. They also, everything is like fast food, everything is fast. Everyone wants everything to be delivered faster, as fast as possible. So government will have to adapt. Government is adopting. And I can tell you, nowadays, whenever our Principal Secretary, Chief Secretary, or the ministers, or Honorable CM, whenever the direction comes, it was like, this is to be done. The timeline, it should have been done yesterday. So now we go to the drawing board. I'll tell you, there are several examples in West Bengal, like during pandemic. I was then in finance department. We were told that we will be paying money to the migrant workers who are living outside West Bengal. 1,000 rupee to them who are Bengalis living outside West Bengal, migrant workers. You have got 48 hours time, make an app, make it live, and then day after tomorrow, Madam CM will inaugurate it. And we had to do it. We did it. And then that app was live only for 15 days. We transferred some 348 crore rupees through that, and then it was done. So nowadays, those were the times when it was like, they still, but in the perspective of citizen, sometimes still we are not up to the expectation in some field or other field, but we are trying very hard. Everywhere in entire country, you can see the animal spirit has been unleashed nowadays, and government is also equally proactive. We are doing whatever needs to be done as fast as possible. Everything. You know, in my view, after 10, 15 years, if this 5G launch, 5G, cloud, and mobile phone, these three things are going to be roti, kapda, and makan of future. And with this, I expect by 2030 or 2035, no citizen of India will need to visit any government office at all for any service, anything. So that should be the vision on which government and government officials should act, and it will be realized. It will be realized, and it's realizable.
Thank you, Randhir. Sorry, I missed you, Parul. So we have one speaker from Arunachal. Arunachal is the far east state, very sparsely population and huge area. And that is where the technology can actually, create a revolution and bridge the geographical gap created among people by the nature itself. So she's also heading IT as well as transport, right? So I would like to request you to share your experiences, how you are using technology there to bring IT services to the people, or rather all kind of citizen-centric services to the people.
Good afternoon. Thank you, Elets, for inviting me here and giving me this opportunity to represent Arunachal Pradesh and share the initiatives taken by the government and how we are using technology to bridge the gap between the requirements of the citizens and services that the government is providing. Now, we all know that technology has power, immense power, to transform the lives of people and create multiple opportunities. Being a welfare state, that is what the aim of the government is, to bridge that gap and provide those opportunities to the citizen. But we all know that still there are limitations to the access of technology to the people, and states are making continuous efforts to bridge that gap. Now, Arunachal Pradesh is a unique state in a lot of ways, and because of its distinctive characteristics, the challenges that are being faced by the states are also unique. So one of our major challenge is connectivity. Now, when we don't have connectivity, we can't really talk about technology. So the priority area of the government is providing connectivity to every part of the state. The government are taking a lot of steps. I'll talk about the steps later, but first I'll talk about the unique challenges. Connectivity being the one. Second is literacy. We are still at around 60% of the adult literacy, and when we talk about digital literacy, the rate is much, much, much lower. Another issue is the terrain. Because of its special geographic location and being a border state which shares the longest border, international borders, and the weather conditions, we have issues like torrential rains, frequent landslides, dense forest. So these again creates a lot of challenges when we want to follow the traditional way of connectivity like optical fiber, because whenever we lay down fibers, there are landslides, and then again the services are disrupted. Now, besides these, another issue is coordination because of the geographical terrain, and it is a huge state. With terrain varying from mountains to plains, and terrains which are still covered with forest, and where accessible roads are not there and people still do head loading and travel on foot. Coordination becomes an issue within government itself because of the time and space constraints. Another major issue is the mindset. As we are aware that Arunachal actually is a state of tribes. We have 26 major tribes and around 100 sub-tribes. So the mindset of the people is also a little different, and even government officials, they are averse to changes. So it takes a lot of time in bringing change and reaching to the last mile, and to facilitate and to convince them to use technology. So given these challenges, unique challenges, the solution that has been adopted by the government is two-pronged. One of the step is definitely to expand access to technology, and at the same time to develop and promote skill development and digital literacy. Now, over time, it has been realized that developing digital literacy takes more time and initiative than expanding the technology. Now, in view of this, year 2022-23 has been announced as the year of e-governance. So special focus has been made on e-governance activities, and 22 projects have been picked up with special focus, which were to be implemented in this year, and I'm happy to say that we have already implemented 20 out of the 22 projects. Now, talking about connectivity, since it is a major focus area, this has been picked up in a mission mode. We have schemes like 4G saturation and 4G connection, where BHL and BSNL, they are providing, they are working day and night to provide 4G connections to around 3,000 villages. Besides, because this, again, this requires laying of optical fibers, and because of the terrain and weather issues, this takes time. So we have also adopted VSAT as an alternative backup. We have connected our unconnected CO headquarters, gram panchayats, higher secondary schools, girls' schools through VSATs. Besides this, one network has also been taken up in the state, and to connect all the government offices. We have already connected around 300 government offices with SWAN network to provide video and audio connectivity. Another innovative step taken by the government is air fiber connection. So we are using micro links in far-flung areas like Mechuka, which has connectivity issues. So they are being connected through microlinks. Now, besides these connectivity measures, a lot of measures have been taken in the e-governance area and citizen-centric service delivery. One of the major initiatives is e-Seva, where we are providing around 80 services, both ease of living and ease of doing business online. So we have a common platform where all the certificates which are required by citizen on day-to-day basis, like income, SC, certificates, and licenses for ease of doing business, they can all be applied online, and they are issued within a time limit. Now, another major initiative and innovative measure taken by the government is e-cabinet, where cabinet meetings and cabinet decisions, they are organized online. So we have cabinet meetings every month, which are organized online. The entire decision making, right from putting in the cabinet notes to final decisions, they are all placed online through e-cabinet. E-office has also been taken on a mission mode where in fact, Arunachal stands first in implementation of e-office in the northeastern states, where we have penetrated till the CO headquarters. So with the issues of connectivity, also, we have made sure that all our CO headquarters are connected on e-office, and day-to-day filing is done on e-office, which gives more transparency and accountability to all the decision making. Then EDPT is another initiative taken where all direct benefit transfers, around 50 schemes, they have been onboarded, and we are doing all the transfers through EDPT portal. A lot of app development has also done with these portals. So most of the portals also have an application base which are easy accessible to the people, so that there's more inclusion of the people. Besides these, another major initiative is EILP. Arunachal is a place where you need an inner line permit to visit. This has been a long-standing issue for the state because issuing of permits will take time, which will discourage tourism and day-to-day activities. Now, we have developed an app, Tourist EILP, where the person who wants to visit Arunachal can simply apply online, and within an hour, they get their inner line permit, only based on mobile OTP. So they fill in the details in the application form, they get an OTP, and they fill in their place that they want to visit with the dates and everything, and it is an auto-generation application. This has brought a tremendous change, because earlier people would wait for 15 days, and they would try to find out contacts from where they can get the EILP permit in a time-bound manner. So this has drastically changed the tourism pattern also in the state. Now, besides this, we have adopted a lot of dashboard-driven schemes like CM Dashboard, e-Pragati, where data is fetched and which is used for policy decision-making. Atmanirbhar scheme, again, for some of the sectors like agriculture, horticulture, etc., where all subsidies applications are made online, and the applications are also approved online. Besides this, we have hospital management scheme, telemedicine schemes, which are connecting far-flung areas through audio-visual consultancy. In terms of digital literacy, we have also started a skill development scheme where the nominations are taken from various districts, especially the backward ones, and they are given skill development training, and also they are also provided job in BPO sectors and other sectors to enhance the digital literacy in the state. Besides this, we are also in the process of we are streamlining a mechanism where digital literacy will be taken up in each districts and across various platforms like schools, colleges, so that more and more inclusion happens in the digital framework of the state. Now, these are some of the initiatives, and yes, after this conference, we'll get more ideas. where we can, which we can take up, and we can bring significant changes in the citizens. Thank you.
Thank you, Parul. Nice to hear from Arunachal. This is the one state which I have yet to visit, and now I think we have to make this. I have to make this plan to visit Arunachal as early as possible. Thank you, all the co-panelists. Do we have time? I think we are already short by 10 minutes. So, do we have time for? No, we don't have entire time for any quick question from the audience. Okay, so we are running short of time. We are already short by 15 minutes. So, I'm sorry for this because we could not manage time well. I thank all the co-panelists for sharing their experiences, all our responsible officers from the state. It's good to see all of you from all the states. Very few chances we get to meet people from other state during the course of our work. Thank you very much.
Thank you so much. This was Shri Kumar sir, who wonderfully moderated this panel discussion on leveraging technology for citizen empowerment and last mile inclusion. In fact, it was a truly delightful experience to hear all these wonderful set of panelists. And I think we all did justice to this topic, and we got to know a lot of examples and challenges which states are facing and how they are addressing it with the use of technology. Also, through our program chair, Randhir Kumar, he wonderfully explained us about how Department of IT here in West Bengal, who is the host partner of today's program, is taking the initiative forward for the technology enablement in the state. So I would like to request all the panelists to stay for just a couple of minutes for the Memento giveaway ceremony. And I would like to welcome, we have a very senior officer, the Municipal Commissioner of Kolkata Municipal Corporation, Binod Kumar sir. If you can, sir, come on the dais and please felicitate our speakers with the speaker Memento. Starting with the first panelist, Shri Narayan, Swaroop, Nigam. I think he has already left. I would like to, sir, Binod Kumar sir, please, if you can come on the stage for speakers Memento giveaway ceremony. Can we have a round of applause going for all the panelists? It was a great panel discussion indeed. I would like to request Shri Rajiv, Rattan, the MD of HARTRON, Binod Kumar sir, if you can give the speaker Memento to sir. Next we have Madam Prashasti Pareek, the Regional Commissioner of Municipalities and CEO of Dahod Smart City. Sir, in the center. Sir, if you can please be in the center. Next we have Dileesh, Sasi, who is the Director of Electronic Delivery Citizen Services from the Government of Karnataka. It was great experience hearing you, sir. Next, Madam Parul Gaur Mittal, the Special Secretary of Department of IT from Government of Arunachal Pradesh. Thank you so much, ma'am, for coming all the way and enlightening us about your views and opinions. Next, we have Madan, Mohan Chakraborty, our industry partner from Iskraemeco, the MD and CEO. Next, for our moderator of this panel, sir, you wonderfully moderated it, and it was within the time limit. Shri H.K. Kusumakar, the Additional Commissioner of Police and Chief Information Security Officer of West Bengal. And lastly, for our program chair, a token of gratitude for Randhir Kumar, sir, the Secretary of Department of IT and Information Technology. Thank you so much, sir, for being part of this panel discussion, and once again for giving Elets and eGov an opportunity to partner with the Government of West Bengal IT Department for hosting this session.